When I first found out I wasn't healthy as I thought, first thing came to my mind is how long I have left here on this earth. I have a family, a history of heart disease in our family from my grandfathers on both sides, my grandmother, my sister, my brother, Charles Ferguson, who passed at age 58 of a coronary artery disease. So heart disease has been a part of our family, and it's something that I wanted to take on early on in my life. And at age 25, I've always got my heart checked. I thought I was doing everything right. Common sense wise, I knew I had to cut back on this, stop this. But what really shocked me was the numbers that I got at the walk.
Cardiovascular disease is the #1 cause of death for all Americans, and particularly for Black men.
We were able to screen over 5,000 men last year on our Black Men's Wellness Day national tour. 85% had high blood pressure, 56.7% had no idea. 10% on average that show up to our events and get screened are going directly to the emergency room. We are doing everything that we can to make sure that our men know that we have a program that's truly going to help them save their lives.
Better, mentally and physically after participating in Black Impact. So I really enjoyed the experience.
Brothers Keepers! You a lot about, how to shop for groceries, serving sizes, consistency, and you can just feel your body begin to transform.
Hey, Coach. Yeah. Yes, sir.
Going back to the beginning of Black Impacts, in 2019, we had been looking at the numbers from the walk, the African American Male Wellness Walk. And at the walk every year, 20 or 30,000 people that are showing up for this huge walk. Now it's really a day, all about it. It's health fairs and everything going on at the walk. But what we saw was, for many years, we had this mantra of know your numbers, right? And so, know your blood pressure number, know your cholesterol number. But unfortunately, both with men at the walk and then ultimately in the data, which we were working on together, those numbers weren't changing. So people were coming with high blood pressure one year, 190 over 130, right? And then they come back the next year, I say, man, your blood pressure is really high. Say, oh, but yeah, doc, but that's my number. I know my number, and my number is a really high number. And so that was a challenge that, we could not look away from, and really a clarion call to action that we need interventions and programming to not only know your numbers, but ultimately to improve those numbers.
We pick 100. We actually pick 300 gentlemen that participates in the walk. The walk is now called the Wellness Day. Wellness Day is a day where everyone comes down to one of our cities and get, a health screening and also do a walk. At the end of the health screening, what we do is Ohio State researches all the numbers. Last year, we screened 5,000 people, and everyone was reviewed. The Brotherhood will assist with people coming to get screened, because everyone's going to come. There's going to be 50,000 people here. And of course, you're going to have people saying, well, I just went to the doctor. Yeah, so did I. Come on over and get screened anyway. That's what Black Impact is tasked to do on Wellness Day.
There are two groups when we are working with Black Impact with the men. So we're looking at an intervention group and we're looking at a control group. The biometric process, we use a medical grade instruments that are Abbott. And so we use them also in the hospital setting to be able to look at people A1Cs, which is a 3-month screening of which your glucose is running. And then we also do cholestat, which is your cholesterol, your total cholesterol, your HDL, and your LDH. So we use the medical grade that they use in our labs here at the hospital, so they're very accurate.
First, you do this kind of extensive survey, and you're telling them all of your kind of habits and patterns, and answering different questions. It's long and a bit tedious, but then to be able to go into the screenings and getting your results, I thought it was a really great experience.
So for the first time ever, not just my blood pressure being taken and seeing that the number was high, and then it would go low. But then to have a blood pressure taken where they're looking from your thigh, your leg, all the way up to your heart, back down. Never had that done until this program.
There's a serious impact on the men because they're working together and they're working for a common goal. They want to be healthy. They want to know about their health. They want to know how their medication is working with them. So that's the most important thing about it. For the control and intervention group, it's more of a focus for us as the clinicians, as the physicians, to know when we're doing our research and our studying. But for the men, I think it's all about them working together to make sure that they're getting their health in order.
Men in general, or people in general, are motivated through relationships. And I think what Black Impact does, it gives individuals an opportunity to create a brotherhood kind of relationship. If you really think in terms of, which is how we came up with the idea, when you look at the show Survival, or you think about in Africa how we were raised in groups and tribes, it creates a certain degree of camaraderie and support, and it gives people strength. Because when you, it's like a fraternity, when you are in a group of people who are supporting you, you feel the strength you need to keep going. And I think this concept, it gives people an opportunity to create some relationships with some people that they may not know, but they are going through the journey together. And at the end of it, they're accomplishing a goal, but they call accomplish it with someone.
Every week, I get motivated knowing the Thursday's on its way. I can't wait to weigh in. I can't wait to hear an example or something somebody triumphed, they overcame. This motivates me, and I tell the group that all the time. They motivate me. They encourage me. Just by their presence. Just know that they're there, they're gonna hold me accountable.
Then there are also those moments before and after where we're able to just connect. Like, hey, how are you doing? How's the week been? They'll see me and they'll see, like, maybe I'm a little off, or they can tell maybe I haven't been having a good day. And then they'll really, afterwards, they'll really follow up and check on you and see how you're doing. I've had the opportunity to just, just stand there and pray with some guys because they see I was struggling. And that just encourages and motivates the rest of the group. Even if somebody's had a setback, they know there's that source of accountability and encouragement to stay with it.
I look and see that a lot of these men they'll probably stay friends for life. They'll probably check on each other. They probably will even work out with one another, even after they're done with the study. So, that's awesome. So that's kind of like tribal, isn't it?
It ain't gonna be no shit like that.
I've loved being able to interact and meet so many Black doctors. I think in healthcare, that's also another place that can be a little bit uncomfortable, because you're generally getting medical advice from people who don't look like you and don't speak the same language.
I had a doctor there looking at my numbers, and he encouraged me. He said, man, your numbers really don't look good. This is good brother talk. I said, man, I'm cool. I'm running around, been moving around. And that's why my numbers. He said, well, just try this out for me. And it was his conversation and his handshake that said, hey, I'm gonna try this program out.
They're telling you like it is, these are experts in their field, but they can say it in a way that's very easy for us as Black men to digest it. And there's that sense that they actually care about your well-being.
Who taught me to come to this program? That was you.
That was me.
The program was over.
That was me.
You said, come on, man.
Yes, sir. Yes, sir. Yes, sir.
So I think of Black impact. When it made me realize, after I told that doctor, oh, my numbers are cool. I got this. It took him to take 5 extra more minutes to say, man, you probably do got this. But if you take a look at our program, just for a moment, I hope I can get you to the point you want to be faster, and I'll help you monitor. I'll walk side by side with you as we go through this process.
Through the Black Impact Project, even though my experience has been intermittent, so I take part here and there throughout the program, there's such a sense of community that the men that I've interacted with are very open about their experience and sharing with everyone and anyone, including myself, how this is different. And, one thing that we know is that there's a lack of diversity in medicine, and there's often lack of representation. And no matter who you are more likely to open up and share with someone who's like you, who looks like you, who maybe has the same lived experience as you. And this project, it's very intentional that there is the health coaches and the care providers for the Black men are also Black themselves. And I do think it's really made a difference in building that trust, in improving the that two-way dialogue, and just being vulnerable and open and sharing. And even, though I don't look like the men, and they're giving me that same benefit when I'm there. You can definitely see that sense of trust that has been built.
Yeah, the truth. The truth. Come on, don't hurt me.
Yeah, baby. Yeah, baby.
This binder, one of the first things they give you is a guide and a reminder of what you can do and can't do. They track it. And so they tell you up front, this is your score. They tell you what a good score is, a perfect score, and they tell you where your score is. Out of that 100, I was at a 46. And I'm like, well, how do you get these scores? So each one of these things that they measured, they tell you how you get it. So this 46 was like, oh, that's pretty bad. And this is your results. This is your weight, your blood pressure, your heart rate, your blood work. And so midway through, they do that in the beginning. So my score went from 46 to 72. The goal was to get to 80. So I haven't got my last ones for the end of the program. I pray I got to 80, and I didn't go backwards.
He started at 290.
59. Oh, that's all right, baby.
Yes, it is. Yeah, baby.
And emotions, a little bit sad that it's over. I'm gonna miss working out with the guys, miss the community that people I got to engage with. Build relationships with, work out together, learn about our health together, so that I'm going to miss. Grateful for the opportunity, to engage with the medical professionals, the volunteers, the coordinators, everybody who put these things together.
Black Impact is more than just the education part. Was there anything else that you got out of this, like with the community, like maybe the health workers or anything?
Absolutely. I also have made a really good relationship with my community health worker, Dolores. Just being able to have somebody check on me, have conversations about, if I have the resources I need. Specifically, we talked a lot about mental health and different things that were going on in both of our lives. That's a relationship that I'll maintain and keep going forward. Just to have somebody who cares, that I can now reach out to. It's just been a tremendous resource. Carry these lessons forward in my own life, but also the other Black males in my life, and help them improve on their mental, physical well-being, diet, etc. Been already able to help my mom and my family learn some of the things that I've learned. So, I'm really looking forward to seeing the research and how it impacts Black men and Black people for the long term to improve our health outcomes.
More so, I think the group was the most beneficial thing in him dropping the weight and wanting to keep it off and being serious and being focused with it, because he then had a group of men who were like-minded.
Black Impact, African American Male Wellness Agency, is vital, and it should be nationwide. It should be nationwide. And it saved me.
We're excited because these cohorts that we're having in Black Impact 100 is really being the life-saving program that our men are excited about being a part of. They're in tribes, they're in small groups, holding each other accountable. And to be a part of this graduation for another cohort, it really makes the work that we're doing purpose-filled. It also makes the work that we're doing life-changing, more importantly, life-saving.